We're continuing our reporting on the importance of lead screening during pregnancy, not just when a child is born. The practice isn't required in New Jersey or nationally, but a Rutgers program supported by funding from the CDC is not only detecting unsafe levels of heavy metals in pregnant moms, it's protecting babies from their dangerous and even deadly effects. Senior correspondent Joanna Gaggis reports.
I felt really worried when I was told that the baby had lead in his blood, and I also had lead. I was really worried.
Maria Tecún Morales had no idea she'd been exposed to lead when she was pregnant with her son Jaime in 2022. She found out when she went to University Hospital for prenatal care late into her third trimester and was included in a lead screening program funded by the CDC, run by Rutgers Health.
As part of that entry, she did have a blood drawn, and her lead level at that time was 31. And then less than 2 weeks later, when she delivered, the lead level was 74. Anyone with a level of greater than 3.5 micrograms per deciliter should be considered as having elevated lead.
Lead's been linked with a number of pregnancy-related illnesses that can cause complications, even death, including preeclampsia, thrombosis, and high blood pressure. In infants, it can cause low birth weight and interfere with brain development. So at greater than 20 times the CDC's threshold, Maria's case was deemed a medical crisis, and she and baby Jaime had to undergo chelation treatment.
What that does is it draws the metal, it's not only lead, it can be mercury or other metals, out of the bloodstream, and it binds the medication and then is excreted by the body.
My son received treatment for 3 weeks, and I received treatment for 1 week. And I believe with the treatment, it went down to 5%.
The screening program that caught Maria and Jaime's lead exposure is called the Heavy Metal Screening for Pregnant Women and Children. It operates between 3 entities: University Hospital, where the pregnant patients are seen, Rutgers Health, where Dr. Ona Fofa is in charge of the screening, and New Jersey's Poison Control Center, where Dr. Diane Colello offers guidance on treatment.
What is important that our program has shown, this standard of care, is screening early, especially at intake.
University Hospital sees about 1,400 infant births a year. In the 5 years since they began this testing program, about 14% of those births are babies with elevated lead levels.
I never discovered it. I don't know where it came from.
And while they never found the source of lead, Maria's exposure put her at greater risk of passing lead on during her second pregnancy with her baby girl, Alma. That's because research shows that in certain cases of lead exposure, especially when a person is young, lead can settle into the bones and then be remobilized during pregnancy, passing from the mother to fetus.
There are situations where the bone is undergoing turnover or change, which may release some of that lead from the bone back into the bloodstream, and that's where we detect it. Those situations include pregnancy. They can also include breastfeeding. When lead is mobilized from the bone, we see the lead level rise, not in a large magnitude on its own. Because
lead remobilization doesn't cause large spikes, the team determined that Maria's lead exposure was acute, and both she and Alma have tested below the 3.5% threshold. As for Jaime, who's now 2,
he is doing well. He is doing really well.
Dr. Fofa is preparing to share his research with the American Academy of Pediatrics to ask that the first lead screenings move from the current 9-month benchmark to screening at birth.
Waiting till 9 months, there's a missed opportunity there.
Why?
Because brain development in the first 9 months is very critical.
And a bill is moving through the legislature now that would screen pregnant moms in the first and third trimesters looking for acute lead exposure and lead remobilization. In Newark, I'm Joanna Gaggis, NJ Spotlight News.